afternoon, everyone. My name is Chris Geldart. I'm the Deputy Mayor for Public Safety and Justice for Washington, D.C. We're here today in the Trinidad community to talk about several overdoses that we've seen in this community over the last several days. We know that we have a bad batch of drugs that are in our community, and we're here today to talk about that, highlight it for our community of what we're doing as a city to respond to that, and what the residents can do and those that need assistance can do to get that assistance in this community. You'll hear from members of the public safety team as well as some of the members from our health and human services team on how the city agencies are working together in this community with our federal partners to not only address the drugs that are coming in, to find out where that's coming from and to stem that flow, but also the services that are being provided to the residents throughout this time. What we really want the residents to know is that there is services in your community. We are here 24/7 right now, understanding that we do have an issue and that we will be dealing with that issue out here in community. I'm going to turn it over now to Assistant Chief Morgan Kane, who's acting Chief of Police right now in the city, and she can talk about the incidents that we've had and what MPD's response is. Chief Kane.
Good afternoon, everyone. As the Deputy Mayor said, I'm Morgan Kane. I'm an Assistant Chief of Police here with MPD, and I oversee our Patrol Services North Command. Today, as the Deputy Mayor said, we're joined by our partners in the community and within DC government. Again, today we're here to provide the community with critical information regarding a series of narcotic overdoses that occurred within Washington, D.C. over the last 3 days. Beginning around 10 a.m. on Saturday morning, April 9th, through last evening, April 11th at about 6 p.m. MPD was notified of 17 medical emergencies, 16 incidents, but 17 medical emergencies, all suspected to being narcotic overdoses. These events were primarily concentrated here in our 5th District, in the Trinidad and the Ivy City neighborhoods. One incident involving two adult individuals occurred inside a residence within our 1st District. As a result of these incidents and these events, 10 individuals have died, and the 7 surviving individuals required emergency medical care, with a portion being transported to a hospital and some walking away after the administration of Narcan. The deceased range in age from mid-30s to 60 and include individuals from diverse backgrounds. I want to extend my deepest, most heartfelt condolences to the families and the loved ones of those individuals. Immediately upon noticing this trend, investigators from the Metropolitan Police Department and agents from the Federal Drug Administration began working to find out who put this deadly mix of drugs into our community. Preliminarily, it is our belief that the cocaine was mixed with suspected fentanyl and that is responsible for these overdoses. Members of not only our Violent Crime Suppression Division, consisting of our Violent Crime Impact Teams and our Narcotics Enforcement Unit, will be present in the community, utilizing advanced investigative and evidence collection techniques to find those responsible for harming and killing our citizens. You will also see members of the 5th District Patrol teams as well, disrupting the sale of narcotics in the areas and conducting outreach and educational efforts to our community members. In January, we saw a similar pattern of overdose cases and related deaths in the southwest portion of the 1st District. Through a collaborative effort between MPD and our federal partners, arrests were made in that case. The defendants were charged with conspiracy to distribute cocaine and fentanyl, and unlawful distribution of a mixture of cocaine and fentanyl resulting in substantial bodily injury, and additional charges are possibly pending in those cases. I want you to know that the same team of dedicated investigators that quickly and thoroughly brought those cases to closure are working these cases and have been since Saturday. And I assure the community that they will be laser focused and steadfast in the pursuit of those responsible. Our community is always helpful, and we especially rely on the public's assistance in solving all cases, particularly those such as this. Anyone with information about these events can contact us by calling 202-727-9099 or texting us at 50411. You can always remain anonymous. To our community members listening, Please be careful and look out for one another. If you suspect that someone may be experiencing an overdose, please call 911 immediately so that we can help. A small container of Narcan can reverse a drug overdose and potentially save a life. All first responders are equipped with this life-saving tool, and since March 2019, MPD members have administered over 1,900 doses of Narcan. It's also available to the public, and Dr. Bazran will talk more about that. We ask that if you would like to have Narcan delivered, that you text 888-811 Live Long DC. You don't need an ID or a prescription to carry or administer, and it's free of cost. I also like to mention two very important laws that protect you from being arrested if you call for help in an overdose situation. The Good Samaritan Law, which means officers will not arrest you for any drugs or alcohol on the scene when you sought health care or administered Narcan to someone who is overdosed. The Opiate Overdose Law means that having a kit, needles, spoons, pipes, or other paraphernalia is no longer illegal. You will not get in trouble when MPD officers arrive to help someone who is overdosed. To the loved ones of those that may be struggling with addiction, please check on your family members. Some of these events occurred indoors and out of public view, so we want to be sure that folks are not attended who may be in need of help. Before I conclude, I would certainly like to thank the DC and Fire EMS department for responding so quickly to provide those life-saving medical assistance needs to those that were overdosed and needed their immediate assistance. I would also like to thank Dr. Barbara Bazran and your team at DBH for your outreach efforts and your support. With that, I would like to also thank the DEA and all of our federal partners for their ongoing assistance. I will turn it over to Dr. Bazran.
Good afternoon. First, I'd like to express my deepest condolences to the families of everyone who was affected by this tragic event. When we were informed of an overdoses happening over the weekend by our partners at MPD, the Department of Behavioral Health immediately deployed outreach teams to the Northeast neighborhood to distribute naloxone, a medication that can reverse an overdose and save a life. I want to first of all share with you, this is what naloxone looks like. One of our staff is here right now and actually has naloxone and can distribute it to anyone who is right here. In addition to that, if you would like to receive naloxone, simply text Live Long DC to 888-811. It can be delivered to your home or wherever you'd like. You can also get it via mail, and also you will get the locations where you can go and pick it up if you so choose. I'd like to just briefly demonstrate how this life-saving drug is used. It is very, very simple. This is what it looks like. There are 2 administrations in each of these boxes. If you encounter someone who appears to be unresponsive from a potential drug overdose, lie them on their back, use the plunger to insert the plunger in their nose, push so that you can administer the medication, turn them on their side, and watch them closely. You can talk to them to see if they will become responsive, but watch them closely. At the same time, remember immediately when you know or you think that someone is having an overdose, call 911. This is a medical emergency. So call 911 immediately. Last fiscal year, we actually distributed 58,810 naloxone kits. All of our partner agencies actually helped with the distribution. The other thing that you should know is that not only is it available through the 43 locations that I talked about earlier, but MPD, FEMS, and all of our partner agencies, as well as many of our community-based organizations, have naloxone. We also have another tool in our harm reduction toolkit. Recently, the Substance Abuse and Mental Health Administration allowed states to purchase fentanyl test strips. Fentanyl test strips are an extreme addition and a very important addition to this. This is what a test strip looks like. It comes in a green package that looks like this. Before someone is using, they take this strip out of the package. They mix a pinch of the drug with a little water. They dip the wavy end of the stick in the solution for about 15 seconds. They take it out and they wait for about 5 minutes, and then you will see a line if there's fentanyl in this particular drug. Now, why is that important? It's important because, A, fentanyl kills. I think we all know that. We all know that the overdose epidemic has been spurred by having fentanyl in the drug supply. So if you know that fentanyl is in the drug supply, then you can do a couple of things. First of all, one of the things you may want to do is make sure, first of all, that naloxone is on hand, somebody is there with you, and that you could make the decision not to use that drug supply. We want to save lives to the greatest degree possible, and these two tools are ways to do that. Now, our community response team was immediately dispatched along with our outreach teams when we heard that there was a spike in overdoses. Our CRT, or community response teams, are there to provide mental health and behavioral health support. They can help individuals get immediately connected to services. They can talk to individuals about their desires to enter services, and they can then follow up related to whatever the person chooses. All of these things are extremely important. Building those relationships, making those services available to individuals who are affected by this disease. Substance abuse disorders are chronic relapsing disease. And we have to work with individuals to make sure that they get the services they need, that they know how to get it, and that resources like our community response teams can help them make that choice and get into care. These things are extremely, extremely important. Before I leave you, 2 numbers I'd like for you to remember. 1, Live Long DC. Text Live Long DC to 888-811 if you want information about where to get naloxone, the life-saving drug, or if you would like to have access to fentanyl strips. One of our team members will call you back and arrange for that to happen. You also will get information about where you can get treatment that's close to you. So I think that that's one number. The other number, if you want support for a mental health concern, you can certainly call our Access Helpline at 1-887-WE-HELP. Those are 2 numbers that you should have close. And as I close, the one thing I'd like to say is no one should use alone. No one should use alone. It is difficult for naloxone to save a life if a person is alone. We know that many people are overdosing inside, and they're overdosing alone. So please, please don't use alone. Please look out for those people you love. Have naloxone, and also be sure to have fentanyl strips.
Good afternoon. I'm Queen Anune, the Assistant Fire Chief of EMS with the Fire and EMS Department. And I want to ensure the community that we are working collaboratively with our agency partners. At FEMS, we are operating with a high index of suspicion for calls that are dispatched in the area and are prepared for upticks like we are potentially seeing. We are messaging to all of our members to be on the lookout for changes in presentation of symptoms, if any, so we can ensure our public safety and public partners are aware. We are also knowing that prevention and education is very critical in addressing spikes in overdoses. On Monday, FEMS sent out 4 paramedic teams as a part of our OD response team in response to the weekend overdoses. We visited 5 locations, including Trinidad, Minnesota Avenue Corridor, Union Station, CCNV Shelter, and private residences where the residents had overdosed but refused treatment. We have distributed bystander Naxalone kits yesterday and engaged many residents in harm reduction. All of our medic units are stocked with Naxalone, which members can distribute. This is a nasal spray, and this can be left on scene. Our Street Calls Opioid response team is prepared to canvass the areas with our partners. Our partners at the Department of Behavioral Health to hand out information and to educate the public. In the event of an uptick in calls for service, our department is prepared to stage resources as necessary to decrease response times for the duration of this event.
Okay, so as you heard from all of our public safety and health and human service team, we're here in the community, we're paying attention to what's going on. Our condolences to the families of those that have lost their lives, and we're here, we can answer any questions you may have now.
Sam?
Sam? We'll do media questions and then community questions after that.
I just wondered, is there any way that the people look? I mean, is there anything you can physically see that indicates somebody may be overdosing on fentanyl or something?
Chief, you want to take that one?
We have different presentations based on individual cases. We look for things such as pinpointed pupils and unresponsiveness, but there are a range of different symptoms that we approach.
So people could fall out. It wouldn't be fentanyl. You just don't take a chance. Just call
Right.
somebody.
We do full assessments, and we're on high index of suspicion.
Now, was this a particularly busy weekend? It sounded sort of like it was.
We're busy all the time, but sure, this was a busy weekend. And again, the incidents that we responded to was not following one another. There was a time span, and they were in different areas. So we were able to put the pieces together afterwards. And now that's what we're standing up and responding to what we've seen this weekend.
Question? It's Chief.
Sam, in the spirit of the question that you just asked, right, we want you to be on the lookout for overdoses, but we also want you to tell us if you know, loved one, friend, you may see it on the street, someone dealing narcotics in our communities. Call us and let us know that as well. Be on the lookout for that. I mentioned texting anonymously 50411 or calling 911 with a good description and location, because our focus, law enforcement focus, is on finding the suppliers of this dangerous drug.
Now, Chief, in the Southwest case, they thought there was a couple at I think, Half and O who were distributing. What about in this case? How were you able to sort of pinpoint it to Trinidad and Ivy City, and any indication there?
Well, as we said, this occurred over a 3-day period, Saturday, Sunday, and Monday. And with the locations that we were seeing, 1200 block of Meigs, Holbrook, West Virginia Avenue, this is where the individuals that we were finding were overdosing at. So it's kind of ground zero for us. But as I talked about with our violent crime suppression division, the work that they're doing with the DEA, there are many other different avenues to investigate. Cell phones, interviews with the overdose victims that actually survived and get the information from them. So cameras. So when we talk about the diligence of our narcotics enforcement unit and our efforts here, it's not just what you see on the street. There's a lot of work that goes into that behind the scenes as well.
Yes, I have one. It's a
Good.
follow-up to what you were just mentioning, and I spoke with the DEA back in January when they first launched their investigation. I know that they were partnering. How is that investigation, are they working with you guys right now on this? And how is that going to, help to maybe close this quicker or find, those dealers you're talking about?
And absolutely, the DEA is embedded with MPD, and I think the chief, he mentioned it in the press conference that he held in January regarding this. When he stood up the Violent Crime Suppression Division, we have partnerships with federal agencies that we have not historically had, where they're actually working with us out of our facility. So they're hand in hand, lockstep. So the same team that you saw investigate and bring the Southwest cases to closure are the teams that are investigating these cases.
Is it discouraging at all that you do have these partnerships that we didn't have before, but now we're seeing, like what we saw over the past 3 days?
Oh, no, we are not discouraged. And I'll tell you why we're not discouraged, because this was a loss of life, right? And we have suppliers that are consciously making decisions to distribute this poisonous drug in our community and killing people. So we're not discouraged. If anything, we are motivated. So in that space, no. And we will close this case. Absolutely.
Other press questions? Hold on, let's see if we have one more on topic.
Regarding the Good Samaritan laws, you won't get busted for paraphernalia or drugs if you call for help for medical assistance. Still, some people might be reluctant, thinking, okay, I'm on, now they know where I'm at, they're going to come get me. So how would you counter those concerns?
I'm going to let the chief talk for a second, but I'm going to cover it from a larger perspective. We want to save lives. We understand that drug addiction is a disease, and we want to make sure that we're saving lives. So first and foremost, we want to save that life. And that's what we're going to go there to do, and that's what we're there to do in that instance. Chief?
And I think the deputy mayor summed that up very well, right? We want people to take advantage of the Good Samaritan law. We are encouraging people to report overdoses so that individuals can receive medical treatment. We are encouraging people to get Narcan kits delivered to them, picked up, so that they can administer. That is why we're here today. Our focus isn't on the person overdosing. Our focus is on the supplier of the drugs into the community, where we are, Dr. Basmar, she said it, this is it's a reoccurring addiction, and we want to go after, and we will go after those people that are preying on the vulnerable population that have addictions in our communities.
So one off-topic question. The 15-year-old boy was killed. We read the release today. Is there anything more you can tell us about that?
There's actually no other information on that, Sam. That's a tragedy that happened in our Columbia Heights area. The investigation that continues. I don't know if the chief's got anything else on that, but that's still under investigation. That's still a very active case right now.
It is, and again,
At the mic, Chief.
And again, get the word out, and I will always press this. We need, although our homicide detectives are on scene investigating this case, and they'll be dogged in that approach, we still need help from the community. If there's any witnesses, if there's any video, if there's something that you know about this case, we really need to hear from you. 202-727-9099 or text 50411. Okay.
Okay. Take community questions. Yes, ma'am.
You're not making it easy for people to get jobs out here, okay? First of all, you want to know why they're selling drugs? Because they want to make an end to make a living, okay? At the end of the day, you're making hard for people to get jobs out here. If you have a little bit of this, that, and the other, and you're doing so what? Everybody is doing something out here at the close of the day. Now, you made liquor legal.
Ma'am, can we do you have a question for the group here? Because we've got a bunch of people that are going to be responding to this out here, so we'd like to do that. Go ahead. Yes, ma'am. No, go ahead. Go ahead.
At the end of the day, you want me to say something, to say this, okay? At the end of the day, like I said, liquor is legal, right? But yet, at the end of the day, people still dying from that, killing people every day, right? But you still in the black community. In the black community. All right? Now, you talking about people selling drugs. All right, but guess what? When you go to DC Power, Empowerment, and stuff like that, you gotta what? You can't get food stamps, you can't get no type of income, anything like that, and in order to get a job. When you go on these interviews and do these jobs and stuff, they make it hard for you. It is hard. I want to know how many black people in the black community, okay, is bringing cocaine over here on the ships, okay? How many poverty people in the black community have the power to bring this stuff over here? It's not just us. It's somebody else higher up. Instead of you looking at us on the corner doing it, look at the people higher up. And the congressmen and senators and stuff like that. They sit in their hands, throwing the bricks.
Go ahead, Chief.
So,
Okay, and with that being said, excuse me one more thing.
mhm.
I'm gonna ask you, you know what? I live right down the street right here. There's a lot of rapists and pedophiles in that neighborhood, and guess what? Ain't nobody said nothing to us in this community. It's Latinos.
So if I may,
Black Americans.
if I may, I hear you. I hear what you're saying, and I appreciate the frustration in your voice. And I would love to talk to you after this, right? I would love to talk to you after this. But what I do want to say, remember, yep. Remember when I told you that we're going after the suppliers? So that means every level of the chain. That's not just the person standing on the corner. That's not just the person standing on the corner. That's every level of the chain. And that is what we are seeking to bring. That is who we are looking for. And so in this space,
I've been locked up and arrested, okay?
yep.
And guess what? You locked me up, but you won't tell me if I take you this, that, and the third.
We are going to have the conversation. I'm going to be right over once we conclude this, and we will have that conversation. Absolutely.
And guess what? My name is Yvette Denise Slip. I live at 1219 K Street, Northeast, right the street here. And I have no problem with telling nothing's going on in my mind. There's a lot going on in this community that needs to be addressed and concerned
Okay.
and answered.
Any other community questions? Okay, thank you, everybody.